Will Dow. Will is joining us from Berkeley, where he is the director of the Center on Economics and Demography of Aging. He is a professor in the Department of Health Policy and Management and also a professor of demography. And Will was at UNC for a number of years earlier in his career. We'd like him back. But Will, he's also studied the economics of health insurance, of health behaviors, and health and demographic outcomes. He is a research associate at NBR and also previously served as a senior economist at the White House Council of Economic Advisors. And today he is going to talk about female sex workers in the time of COVID, a longitudinal study in Tanzania. So we are thrilled that you could join us. We wish it were in person. And Will has said he's fine with having some questions during the talk. So if people want to put something in the chat, I'll maybe call on you and then you can unmute yourself and ask a question. So I'll be trying to monitor that. And then we'll have, big sort of free-for-all Q&A towards the end of the hour. So Will, thank you so much for coming. We've been looking forward to this.
Thank you so much for inviting me, Elizabeth. I've really been looking forward to it as well. I wish I could be there in person, as so many old friends there. I'd love to be able to just be able to chat on the side with everyone. I know we're all missing that in the time of Zoom, but it's great that we can do this as well. As Elizabeth said, I sort of running an aging center at Berkeley now, and some of that came out of work that I was doing at UNC. The actual David Blau had an aging center at UNC, a small aging center, and gave me a pilot, and it started off a longitudinal or Costa Rican crevice survey back 20 years ago. Right now, what I'm going to do is talk about a different project, though, that's not aging related. Some of our aging work is stuck in the field right now on pause due to COVID because of the health sensitivities of the elderly population. And I know that sometimes these Zoom presentations can be a little bit difficult and dry, so I thought I'd present something a little bit more edgy. So let me share my screen here, see if this works. Okay. Can you see my screen?
Yes, looking good.
Excellent. Okay, so I'm going to be talking about a project examining the market for risky sex in Tanzania in the time of COVID. So this was a side project from a HIV prevention trial that we've been doing in Tanzania for the last few years. And so we've been in the field with a cohort of female sex workers in Dar. And when COVID hit, it disrupted lots of things, but we were able to collect some interesting data that we're coming out of the field from right now. We're actually still finishing data collection, so I'm giving you a partial snapshot of some of the data about these the sex workers in Dar. And what that means also is that I'm really looking for comments. And this is early stage work, so this isn't a polished presentation. I'd love to hear your sort of comments and suggestions about what else you'd be interested in us doing with these particular data. So just to motivate this, let me show a graph from a study that was published last year in Sexual Health. And so this is a graph of the international male sex worker market. This is just a website, and hopefully you can see my mouse. This dotted line on top are the number of profile views on this website for male sex work. And you can see that right around when COVID hit, there was a drop off in, we'll call the demand side of the market. And then after several months, it seemed to be recovering. This is consistent with what we're hearing in a number of other studies in different contexts. So there's very little work that's been done in Tanzania, but there does seem to have been a sharp drop off in the sex work markets in the beginning of COVID, and then some recovery. But most of the studies that have been published so far have really been around these first few months when there was sort of shelter in place. It's also interesting to look at the supply side of this particular market. So you can see these top bars are the total number of active profiles of the sex workers, and there was a drop off in active profiles of these workers. So it looks like some people were dropping out of the supply side of the market. All the way down at the bottom, these little lightest bars show the number of new entrants into the market, essentially new profiles on the supply side. And it seems to be that there was a drop off in new entrants into the market as well. But again, all of this is quite early. And I'm going to be showing you data that is measured more in the summer of 2021, so over a year into the pandemic, that would be more of a snapshot of the sort of longer term effects of the pandemic while we're still in it, but without shelter in place. So the outline of the talk, what I want to do today is first, I'm just going to start with a simple stylized model of the sex work market to help us conceptualize and interpret some of the findings that we might have, develop a few predictions. And then I'll talk about COVID-19 in Tanzania in particular. I'll introduce the female sex worker cohort data, and I'm going to have FSW in all these slides, that's female sex worker. I'll present a little bit of data on some of their income shocks, and then some of the changes in the market in terms of the market sort of price and quantity, and the changes in client mix and income. So all of this data is from the supply side of the market. It's from interviews with female sex workers. I don't have any data from the demand side of the market per se. And then we'll sort of wrap up. So super simple conceptual stylized model. Just think about the demand for female sex work. There's clients, there's going to be a downward sloping demand curve as usual. As price goes up, we would see some less quantity demanded. But most relevant to this case is that when we have a shock, such as due to COVID-19, we would see potentially a shift in the demand curve. So for example, we think that there were negative income shocks in many places, including in Tanzania. And so that would shift the curve in. So we would see decreased demand. If potential clients are concerned about the risk of acquiring COVID-19, then they may decrease demand. There may have been fear of arrest for violating either shelter-in-place policies, although that was less of an issue in Tanzania, or periodic crackdowns on female sex workers. In many contexts, there were sort of increased crackdowns in female sex workers during COVID, some of that in Tanzania as well. It's also possible that we could see a shift out in demand. For example, if we see a decreased opportunity cost of time, there may be some people whose work is closed, and they may be sort of more active. It may be that other types of leisure activities have shut down, and so there's fewer substitutes. On balance, based on my reading of sort of other work elsewhere, my expectation is that demand would be going down. But again, most of these places don't have sort of long-term effects. I won't have data on demand. I'm just going to assume that overall, if anything, the demand curve is shifting in. But what I really want to do is talk about the supply side, because that's where I have data. So again, we can think about the supply side as the price in the market is going up. You're going to have more women that are potentially going to be going into sex work. But when COVID hits, we may have a shift in the supply curve. So it may be that women are worried about the risk of acquiring COVID, and so they're will sort of get out of the business temporarily. So that's consistent with women charging more, protecting themselves by charging more higher prices without a condom, for example. There's also been a nice paper published in JAMA last year showing a decrease in transactional sex activity in rural Kenya during the early phases of the lockdown, although again, it's a little bit difficult to tease out the supply and demand side of that. It's also possible, though, that we could have shifts out in supply. So it could be that because of negative income shocks and other sources of household income, more women need to go into female sex work, or sort of increase their volume of activity. So again, that's consistent with the substantial literature, some of which we've done in Tanzania, showing that when women have negative economic shocks, they're more likely to engage in transactional sexual activity. And it also may be that there are health shocks in the household that raise expenditure needs to pay for health costs, et cetera. And so that may be another reason why supply may increase. Although, for various reasons, we think that overall, the prevalence of large health shocks will be fairly low. And when they happen, they're serious, but it's sort of fairly low during this period. So then we can sort of put all this together in the market. Of course, if we just think about supply shifting in, what we would have is, if there's a large decrease in supply in the market, potentially we have a price increase that's going to happen in the market. If there's a large shift out in the supply side, we might have a price decrease as there's sort of more competition. What we can also do is think about what would happen if there's a decrease in demand and, say, a supply shifting in. So women are decreasing their supply of sex work. So in this case, if the supply shift, if there's just a small decrease in sex work, but a big decrease in demand, then we would go from some initial equilibrium down to a new equilibrium that may have a lower price and lower quantity. But if there's a much bigger shift, decrease in supply relative to the drop in demand, we might actually see an increase in price in the marketplace. So what that does is provide us essentially a prediction that we can test. So if we see the price increasing for sex work transactions, then what we can do is make an inference that supply is shifted in. So that gives us one sort of nice testable prediction. The converse doesn't necessarily hold. So we may still see that supply is shifted in, even if the price decreases, if the demand is shifted even more. So I'm going to interpret that as essentially a weak test for whether or not supply is shifting in. That we'll test by testing whether the prices in the market are increasing. On the flip side, if we see demand shifting in but supply is shifting out, what we might see, again, if there's just a small shift out in supply, then we could see that the quantity in the sort of equilibrium sort of quantity in the marketplace is decreasing, the amount of transactions that we're seeing. But if there's a much bigger shift out in supply relative to any decrease in demand, then we could predict that there would be an overall increase in quantity in the market. So again, what this is going to do is give us a test that it's a sort of weak test for whether or not supply is shifting out, that helps us to tease out supply versus demand shocks. So if we see that the total quantity is increasing, we're going to take that as, interpret that as supply shifting out in the market. So just to summarize those predictions, I went through that as somewhat fast, not to belabor it. But what we're going to do is test for whether prices are increasing in the market. And if they are, that's going to suggest that supply is shifting in, that the women are perhaps worried about COVID, and so they're decreasing supply. On the flip side, if we see the quantity of transactions increasing, that's a weak test for supply shifting out. And then if we have other combinations, then they'll be somewhat ambiguous. We can't tease out the supply versus the demand causes of them. Now, of course, there's lots of caveats in doing this. First of all, in order to infer that any higher prices are due to the supply shifting out, I have to make an assumption that the demand is not shifting out. And again, as I said before, I think that that's probably likely to be accurate based on other information we have, but that needs to be further verified. It's also the case that female sex workers offer sort of multiple products, so to speak. And so, ideally we would want to hold constant the details of the transaction. And I'm not going to show you sort of full sort of hedonic regression models today, but I think the results are sort of consistent with that, holding constant transaction types. But, for example, if we do see some substantial substitution between the types of clients that female sex workers are working with, or the types of transactions, then that would be some other interesting margin for behavioral change. And again, another caveat to what I'm going to be showing today, the data that we have is only on a cohort of female sex workers who were engaged in female sex work in 2018 when we enrolled this cohort. So we don't actually observe new entrants. So to the extent that there are lots of new entrants affecting the overall market, we won't be able to get at that. It's also the case that we're following a cohort who's difficult to follow in the best of times and even more difficult during COVID. And so it may be that there are sort of non-response issues that are going to be systematically related to these women's response to COVID. So for example, women who drop out of the sex work market may systematically be disappearing from our sample. We've done some work to try to get at that, but that's still some ongoing. So that's the sort of background setup on the model, just to help us interpret what we're going to be looking at in the data when we essentially just observe the combination of the market supply and demand in terms of the price and quantity that's observed. So let me talk about the data for a minute. So the data are coming from what we call the RESPECT-2 trial, which is an HIV STI prevention randomized controlled trial with female sex workers. It's building on a study that we had done about a decade ago that we called the RESPECT study. And it was joint with Damien DeValk, who's a collaborator on this work that I'm talking about today. And in that particular study, we tested a HIV prevention system of rewards, which were conditioned on periodic negative STI tests. So they were conditioned on curable STI tests, not conditioned on HIV. But if someone was in our periodic testing, if they tested negative, then they would get a sort of cash reward, cash transfer. If they tested positive, they would not get the sort of cash transfer. They would get free treatment, more counseling, come back a few months later. What we found in that trial was about a 27% decrease in STIs. That was in a rural population, sort of general population, young people ages 18 to 30. That particular study was not powered to look at HIV seroconversion in particular. So what we did was start designing a follow-on project, which was going to be in a higher risk population. And so we decided to try to work with female sex worker population, doing this in Dar es Salaam. And we, about starting 5 years or so ago, we ran a couple different pilots to look at different ways of implementing a cash reward system conditional on negative STI tests in this female sex worker population. And we have one paper where we published the results of that. What we ended up doing was designing a study we're calling this RESPECT-2 trial, where we enrolled over 2,000 female sex workers in Dar. We recruited them in 2018, so 3 years ago now. It was originally for a 2-year RCT, but COVID sort of interrupted things for a time, and it was extended. It's a lottery style sort of random STI testing reward system. I'm not going to be talking about the trial at all here, or any of those results, just as background where this cohort came from. We recruited them using respondent-driven sampling. This is a hidden population. It's hard to get fully representative samples. We have a large sample though, depending on the estimates that you look at, there were anywhere from 6,000 to a couple tens of thousands of women in DAR who engage at different levels of female sex work activity. We were trying to sample from women who are primarily engaged in female sex worker activity as their primary source of income. We also, because of the nature of this being an HIV prevention trial, the inclusion criteria required women to be HIV negative when we tested them at baseline. So we're only following in this study the women who started HIV negative. So they're going to be slightly lower risk than the general sex worker population potentially. Estimates are that maybe 30% of female sex workers in DAR are HIV positive. So it's a big node for transmission, which is why it's so important to study this particular population. And we had sort of weekly drawings of sort of 10 women to come in for random testing. And as part of that, we sent text messages out weekly to all 2,000 something enrollees every week for the last few years, and that hopefully tried to make it easier for us to track them as well. Although there are lots of tracking issues I'm not going to get into today. We suspended the trial for about 8 months in 2020. And then we sort of resumed it. And this summer, we've been doing end-line surveys. Starting in June 2021, what I'm going to be showing you are primarily surveys that were conducted in July and August of 2021. And so we've tracked about half of the sample at this point. So I'll be giving you results from about half the sample. So let me give you a little bit of background on COVID-19 in Tanzania. And I think many people characterize this as denialism. In March 2020, when the first case was reported, the government initially closed the schools, universities, banned public gatherings, except for churches and mosques. There was sort of widespread business disruption, as in many other places. In April 2020, mask wearing was ordered in DAR, but the government very quickly started to get cold feet about this. And in April, they published their last statistics on COVID for a long time after just about 500 cases reported. In June of 2020, the president declared that God had eradicated COVID-19 from the country, ordered schools to reopen, and he was hoping that life would go on as usual. Of course, what we had was many informal reports of multiple waves of respiratory illness and death in Tanzania in the subsequent months. But the president at the time refused to endorse masks or vaccines until finally in February 2021, the president reversed and started encouraging masking in a sort of tepid way. And there was much disinformation that was going on about folk cures, et cetera. The president died in March of 2021. Some people claim that it was partly related to complications due to COVID. Don't know. But the new president, she quickly acknowledged COVID concerns, urged precaution, including social distancing. But by then, the public was very divided. It was a bit reminiscent of the United States, very divided about mask use, vaccines, the seriousness of the pandemic. Go on to June of 2021, so just before we're collecting our data, so I want to characterize what it was like when we're collecting our data. The president warned of a third wave that was going on in many areas of Africa, including Tanzania, based on hospital and death volume. She instructed people to mask, but did not issue mandates or restrictions. Finally, in July, issued some updated data on cases. Began a vaccination campaign. When schools reopened in July 2021 for the new school year, they were required to mandate masks and other precautionary measures. So there was increasing precautions about COVID at that point. In September, some of the latest data suggested there have been 25,000 cases by then, so there started to be more acknowledgement of cases. But there's really almost no research documenting COVID in Tanzania. Much of this is from media reports, and that's due to the political sensitivity. We were sort of cautioned away from including much explicit data on COVID in our surveys. there was a nice paper which came out in JHPPL just recently about how street level bureaucrats and public health, local public health officials sort of adapted and responded to try to promote prevention during the pandemic with sort of mixed success. But there were sort of many efforts at the local level despite the sort of federal denialism. So that's all I'm going to say about the background of COVID in Tanzania. So let me start showing you a little bit about my data to characterize the sample. So in the full sample for the trial, there were 2,206 women. I'm going to be showing you data on the earlier end-line respondents, close to 1,000 women, 979. Here on the right are p-values showing the statistical differences between the end-line respondents and those who have not yet responded to the survey to get a sense of how representative these respondents are of the RDS population that we recruited into the larger trial anyway. So the average age of the sex workers, they're in their mid-20s. There are small differences in age. They're statistically significant, but given the sample size, they're really not substantively meaningful, a year's difference in age. Education, you can see that the majority of women have sort of completed primary education, but there is a quarter to a third of 30% of the women have some secondary or completed secondary education. Most of the women are single or sort of never married. About a quarter of the women are sort of divorced or separated. About 40% of the women are living alone, but another 35% of the women are living with family. Sometimes the family knows that they're engaged in sex work, sometimes not, they report. Very interesting, 70% of them, 75% of the ones that we'll be reporting on have children. So this is population with complicated lives, and the fact that they have children means that they do have important needs for income. And what we repeatedly hear in our data, both from the formal data and informal, more qualitative data that we have, women are saying that they're continuing to engage in sex work when they do because they need the money for their families. And this is consistent with what sex worker advocates are saying throughout the globe. And now is that this is a very sort of vulnerable population that is going to continue working if they don't have any other sources of funding to support themselves. Looking at, again, the sex work practices and the balancing in our sample, the average self-reported income is around just over $100 when I translate it into US dollars per month. And that's almost all sex work income. Some of the women have some other jobs on the side, but really, and we recruited them predominantly to be women who they're 98% of the women in this sample at baseline said that sex work was their main source of income. In terms of place of work, about 40% of them are meeting clients at bars, a third of them in sort of formal brothels. You can see that these characteristics really aren't very different among our end-line respondents versus the non-respondents, which is comforting, at least in terms of their sort of reported baseline characteristics. But there still may be differential sort of attrition on sort of end-line characteristics that we fundamentally can't measure among the non-respondents at this point. In terms of prices, again, we're seeing sort of similar portion of the market in the women that we're looking at. In terms of clients per week, again, so the average woman is reporting about 8 clients per week, and there's a long tail, some 70 clients per week, and some will have substantially less. About 2/3 are reporting that they use condoms with their clients. And we're asking in a number of different ways. For example, we ask about the last 3 clients and asking them to self-report on condom use, et cetera. So, on average, about 2/3 are reporting that they're using condoms with clients, and that's not different between our sample and at baseline. That's not different between our sample and the non-respondents. Okay, so that was all baseline data. And now let me report on some of the changes that we're seeing in sex work during COVID. So first, just some sort of global sort of self-reported data. We asked them, for example, whether they had experienced any household income shocks in the last 3 months due to the spread of respiratory problems. And that's a sort of euphemism for COVID-19. And we're saying about 1/4 of the women reported that they had an income shock, negative income shock in the last 3 months associated with COVID. And this is when we're interviewing them 16 months into the pandemic, but this is when the 3rd wave is happening. About a third of them, 37% of those women said that in order to cope with this household income shock, they increase sex work. Okay, so this is consistent with what we've seen elsewhere, that when these vulnerable women who have already been engaging in some kind of transactional sex have an income shock, they're likely to increase that sex work. We also ask overall sort of global questions. We ask them, since March of 2020, has your sex work decreased, increased, or stayed the same? So what we're seeing is that 83% of women say that, in general, since the beginning of the pandemic, their sex work activity has decreased. So, while we're seeing that some women with negative shocks are increasing sex work, in a more sort of global sense, many women are saying that they've had to decrease their sex work. It's also the case that now we're seeing about 85% of women say that sex work is their main source of income. So we're seeing some attrition out of the market. And that some of that may be natural. We don't have great information on over a 3-year period what proportion of these women would have moved out of the market anyway. But it's still a large fraction of them are in the market. Okay, so then we asked the follow-up question, and this is just a very general self-reported question, why, among that 83% who reported a decrease in sex work, why did they decrease sex work since March of 2020? On the demand side, we see that about 60% of them said the decrease in sex work was very much due to a decrease in client demand. So they're reporting that there's a drop off in demand. Absolutely, that only 1% said that was not a factor at all. On the supply side, there were 59% of women that said, well, this was actually due to legal restrictions. So some of that was the initial shelter in place, but some of that would be the sort of crackdowns that were happening on sex workers in the street. And then 43%, so a smaller percent, but still a substantial percent, said that they decreased sex work to protect their health against respiratory disease. And we have about a third of the women said that was not a factor at all, or sort of only a little. So there are sort of mixed strategies that women are engaging in terms of why their sex work is decreased. There's some evidence that some of this is from the demand side and some is from the supply side. 71% of them responded that one of these two supply side factors mattered very much. So again, that they're both important, supply and demand. But these global questions weren't designed to be super specific. The timing and duration of that decrease is very unclear from those questions. So next, what I'm going to do is show data comparing the reported activity in 2018 at baseline, when we asked about the prior week or the prior month, and we'll compare that to the prior week or month in our 2021 end-line reports. So this is, I think, a sort of more interpretable way of measuring changes over time. So what I'm going to show here is essentially for our balanced panel, for each one of these, the balanced panel that we have valid reports from, I'll show you so the baseline and end line, and then just the p-value for whether they're different. So first of all, just showing you total income. It's increased slightly from baseline to end line, sort of interesting. There's some inflation in Tanzania, very mild, maybe 3% a year in general. It's hard to know what aspects of the economy that inflation is hitting. So, this sort of small increase would be consistent with sort of inflationary increases. But overall, it's remarkable that there was not a big drop in total income. That's what's most remarkable to me, given what we've heard about concerns about this population elsewhere being particularly vulnerable during the pandemic. So at least by 16 months into the pandemic, their incomes on average had not dropped. Their sex work income similarly increased slightly, increased a little bit more even than their sort of total income, although it's similar magnitude within confidence intervals of the income increase. So this is not a period when there's been a dramatic drop in sex work income by this time, 16 months in. Their sort of place of working changed a little bit, but not dramatically. We're seeing a little bit less work going on in bars, but some of that is sort of moving into the streets or sort of other types of places. And then if we look at average prices, so remember, this is one of the things that we wanted to test. Are average prices going up? So if we had a substantial decrease out of the market, then we would see average prices going up, and that would be a sort of inference if prices are going up that there was a big supply side driven drop in the market. We don't see any significant change in sort of average prices. Essentially, we have lots of different price measures. This is just sort of one sort of general price measure, but they're all sort of consistent that the prices seem to be quite stable for the transaction prices with clients across multiple types of transactions. Their clients per week, though, decreased, which is a bit of a head scratcher given that their sex work income increased. The price didn't change. If anything, maybe went down slightly. But we're seeing about a 25% decrease in clients per week. The use of condoms with their clients also increased substantially from about 66% up to 67% up to 77%. It's a non-trivial increase in the proportion of clients that they're using condoms with. And so then we looked at one other measure here, and this is for each of their last 3 clients. We asked them whether this was a repeat client or sort of a new client. And what we saw was a big drop during COVID at this point, 16 months in, a big drop in taking on new clients. So, among these last 3 clients, the percent that were sort of new clients went from 68% down to 45%. So what we're seeing is that more of these women are working with regular clients. Maybe it's safer. It's unclear why. This is something that we need to dig into. This is one of the margins of behavioral adjustment that we had not anticipated, and so we still want to better understand that. And so they're often they're reporting multiple transactions with the same clients, which is why if you multiply out the number of clients times the price, it's sort of less than the total sex work income. But that's because this is the number of unique people who were clients in the last week. So, again, I think this is sort of fascinating that one of these margins is that they were really moving away from sort of new clients in this period. All right, so I promised to end with plenty of time for discussion, and I hope I've given you lots of material for discussion. So let me just tee up a couple things, and then I will sort of open up the floor to you all. So again, I want to emphasize when these data were from. This was this summer 2021 period when we're collecting the data was a time of increasing concerns about COVID in Tanzania. When there was a third wave that was announced, the president was trying to encourage people to be careful. Schools were now requiring masks, but there was very much, reportedly a mix of the degree of sort of fear versus skepticism of COVID-19. So on average, I would characterize this as a much more permissive social atmosphere compared to most of the studies that have been published so far on female sex workers during COVID, which predominantly were measuring activity during shelter-in-place restrictions when we saw big drops in the marketplace. That's consistent with the graph that I showed you at the very beginning from other contexts. So to the degree there may have been a big drop, so women were telling us that, most women told us that there was a drop off in female sex work activity during COVID. By summer 2021, that may have been sort of much smaller here, and it will be interesting to know elsewhere. So again, reminding you of some of these key findings. Prices, we had tried to lay out some theory to understand price effects and come out with some testable hypotheses. Well, prices were essentially unchanged in the market, which is fascinating. And prices are often sticky in many markets, so that could be part of it. Could also be that there were some new entrants to the market, as I mentioned, that we weren't able to measure. But overall, there doesn't seem to have been a big disruption in the market equilibrium here that would be consistent with a huge change in sex work. The quantity of clients, of distinct clients, again, decreased about 25%, but they're shifting to more regular clients, more condom usage, and their overall sex work income is increasing. It's sort of fascinating. Again, I tried to lay out some hypotheses for interpreting whether any changes that we saw in quantity could be interpreted as being driven by demand or supply. Given the way that we're seeing price and quantity moving, I can't make any strong inferences. Neither of these are consistent with sort of the weak test that we had for supply versus shifts in versus shifts out. Based on those sort of global questions, I think it's probably fair to say that there's been changes in both the demand and supply side of the market, but we need to understand that better. Overall, though, I think it's one takeaway is that female sex work activity is still at a really high level, and this is because they're reporting that they need the money. Again, many of them have kids. Some of them have addictions and sort of other concerns in our data that I didn't show you here, but they're sort of not still dropped out of the market due to COVID. So I'm happy to discuss some of the larger policy implications if you want to. There's many really interesting debates going on about the extent to which legalizing sex work, and both the supply side and the demand side might be more protective for the sex workers, as well as provide more ability to regulate testing, regular STI and HIV testing for the sex workers, which would certainly be helpful in a market where 30% of these women are HIV positive, but in a context such as DAR, it would be hard to sort of fully regulate the market. You're always going to have some unregulated parts of the market. And then the second half of this policy debate, which is happening in many places, but not in Tanzania, is the extent to which, if there are COVID-related, for example, social protection cash transfer programs, should female sex workers be included in those programs? So again, the female sex worker advocacy community has been arguing vociferously that they do need to be included in these social protection programs, because otherwise the women are going to continue to work in a very risky environment, risky not only because of the usual STIs, but now because of COVID. But there are sort of many political sensitivities for sure around that. So it is 9:45, so I'm going to end my slideshow and open up for questions, comments, discussion.
Will, thanks. That was great. Audrey, do you want to ask your question or you want me to do ahead?
Sure.
There you are. Great.
Oh.
Hi, Audrey.
Thanks for this talk. It was great.
I was hoping you'd be here. I knew that you'd have a lot to say about this.
I guess I'm wondering, I mean, it's always hard to tell with quantitative data around sex work and accuracy of what they're reporting, although I feel like the consistency between rounds is reassuring. But I am wondering at round 2, like from the qualitative literature around sex work, that's, nebulous kind of with regular clients, like how they move in and out of the client space, and sometimes are considered more partners than clients. And I guess I was saying, I'm wondering if they just like were supplementing or providing more income to their regular, partners during COVID or during this times of economic distress. And so somehow it's getting like lost in the wash, kind of like they're saying their income's kind of the same, but they have fewer clients because they've restricted to like those more known quantities, people who might feel safer. And those people as well might feel safer with sex workers that they know, and they're just like giving them more money that maybe they're not considering as their amount per sex act or something. I don't know. I'm just.
Yeah, no, it's a great question. And as you say, this is, and this whole topic is messy for lots of reasons. We asked the women about each of their last 3 clients, about each of their last 3 partners, excuse me, whether they were a sort of boyfriend or sort of romantic partner, whether they were considered a friend, whether they were considered an acquaintance. An acquaintance is going to be the most nebulous category. Very small numbers who report acquaintance. And then we asked, is this a sort of regular client? Is this an occasional client? Is this a new client that you've never been with before? So there is a lot of mass in the sort of boyfriend category. And so we can sort of take them out. And yes, there is some sort of reported support for that. And we asked a couple different ways. We asked, about the transaction, and we asked about the support over the prior month that was received from, that particular partner. What I reported here, that the income sort of threw all this together, but we have the ability to break this out. We haven't yet, so that will be really important to break those out for just those that are the reported clients and not these more sort of nebulous ones. And we can't perfectly know how they're categorizing all of these, but I think we can get a pretty good distinction between those who are they're more their sort of friendly partners versus purely transactional.
This also feels like a place where like qualitative interviews would be really fascinating, just to know about choices and decision making during COVID. While weighing, how do you assess risk versus economic need in these times of
Yeah, so we had done a set of qualitative interviews just before COVID hit. And so we have some information on that. And then we have a lot of rich information from the field workers. But right now we don't have any sort of qualitative data to look at on this. But I agree, it would be fascinating to have more.
Thanks.
Thanks, Audrey. That's great. I've got a question, which is, well, sort of 2 questions. I mean, one is, I wonder if you know much, either through your field workers or questions you ask about whether there were efforts to protect themselves using masks or, the various ways one might conceive of trying to do that. So that's one question. And the other thing is whether you know anything about other people providing services where they might have cut back or changed prices in kind of a similar way, like, I don't know, hair cutters or dentists or the kinds of people that are also doing sort of closely provided personal services of some form or another.
Yeah, that's a great question. And I'm very sorry to say that we did not ask about masking when we were sort of putting together the survey. That sort of wasn't the initial intention, and hindsight is always 2020. But it may be something that we can actually add for the last part of the survey. But the very sort of poor understanding that I have is that masks are not common with clients, but there's probably some heterogeneity there. In terms of these other services, cutting back, there was a big decrease in economic activity in general in the first couple months of COVID, and much of that rebounded fairly quickly. So if you look at overall GDP and overall unemployment, according to the official statistics, it took a only sort of fairly small hit overall. So I think there's going to be some very heterogeneous sectors. Tourism took a big hit. But most of these women that we're interviewing are in the tourist market. We're not getting the high end part of the market. But I wish that we had this whole community survey going along with this, and we didn't for this particular project.
Yeah. Okay, thanks. I think Ann Fitzgerald has a question.
Hi, thank you for this interesting presentation. We were working in Tanzania through other projects at CPC, so I'm always interested to hear more information about that. I'm struck by the increased use of condoms that you found from beginning to end, and I wonder if you looked at is it supply available of condom, new programming coming in, if you have any. Because people are asked to wear masks, maybe women are also feeling more comfortable using condoms. Do you have any insights or data related to that? Thank you.
I frankly, this surprised me, and we only saw this finding very recently. You guys are the first ones I presented this to, where this is all sort of hot off the presses. In terms of other programs, this is a population that's actually, there are quite a few programs available for working with this particular.
I'm familiar with it.
And they, the programs are sort of increasing. We asked a number of questions at baseline about access to condoms. What their would they know where to buy them, what the prices were, could they sort of get them for free? And there was quite good access to them at baseline, and the same is true at sort of end line. So I don't think that it's an access issue that's driving this. It would be fascinating to know whether, again, this would be qualitative data would be super helpful here to understand to what extent this was women protecting themselves because of some perception related to masks or otherwise, or whether this is because of the change in client mix somehow. That they're just with some safer set of clients, or maybe riskier set of clients that they feel like they want to use condoms with. But to the extent that these are more regular clients, they may be choosing some types of regular clients who they're able to be safer with in general, both because of COVID and because of their condoms. So there's lots of good hypotheses there. So it's a great question, and we're going to have to think about how we can dig into that.
Okay, thank you. Yeah, it's an important one for HIV transmission and STI transmission. Thank you.
Yeah.
We have a question from Audrey Pereira. Do you have any data on the clients themselves, such as occupations, to assess whether regular clients are staying in the area because of broader COVID restrictions? Then the increased transactions with regular clients may be a function of them being available rather than safety.
The regular clients are available.
They're all staying within a small area, and it's kind of transport, I guess, driven or travel restriction driven rather than safety.
Yeah, if this were thinking about the first sort of month or two in sort of April 2020, I think that would be a sort of good hypothesis to dig into. At this point, in the pandemic, when we're measuring them in summer 2021, I don't think that it's primarily due to transport. And we're hearing from the women that they're regularly going back to their home villages and they're able to sort of go back and forth. So I think that there's a lot of, there is sort of a lot of movement around to the extent that it's, these, again, these men have more time available, and so they're increasing their demand. That would be interesting as well. And I'd love to have some data on the demand side of the market to get at that.
Okay, Audrey Pettifer asks, what is vaccine distribution looking like in Tanzania and Dar? South Africa has seen pretty good rollout, even in rural areas. Curious what sex workers think about the vaccines. Yeah,
so because the earlier president had actually said that vaccines were dangerous, he did not embrace vaccines, and it wasn't until July of 2021 that they started to roll out some vaccines. They've gotten initial allocation from COVAX, but I think it's just like 1% of the population vaccinated right now. So our population, I don't think, has been touched, and we did not ask them about vaccines. Again, we would have loved to have a whole long COVID questionnaire, but we were essentially told that we can't ask about COVID because of the political sensitivities. We have a couple of things that we're able to ask about circuitously.
Okay, then John Knapp says the data has shown a decrease in place of choice for the female sex workers. Would potential overhead payout be a reasoning behind take-home pay being higher in 2021? Do your income measurements account for payments taken off the top to, say, a brothel, bar owner, or manager?
Yeah, so that's a good question. And we have information on the extent to which women are reporting that they have a sort of data, a sort of manager, even apart from the sort of brothel administration. So we're not actually quite sure what women are reporting in terms of, I think they're reporting gross income to us essentially, but the way that women are reporting these is going to all be a little bit different. That's a great question.
Great. Well, if anyone wants to unmute themselves and ask a final question, we have about 30 seconds left. And well, I think we'll wind up. And thank you so much, Will. That was absolutely great. Great to see you. I know you're going to join the students in just a moment after a short break. So thanks a ton, and talk to you again soon.
Great. Thank you so much for having me.
Take care, everybody.